When getting a diagnosis of cancer, it can really feel like you're all alone, but that's not the case. We heard Kelly Costanza's story of diagnosis in last week's Medical Moment, and this morning we've got more.
Earlier this week, we visited with Kelly Costanza, who shared her heartfelt story to become cancer-free. Today, our story continues as we talk to her caregiver and a woman who has now become a huge part of her support system here at the hospital. Joining us now is Susan Foray. She is the Vice President of Oncology and Pharmacy here at East Jefferson General Hospital. Thank you for being with us. We're talking a lot about cancer and what people should know and how they overcome it here at East Jefferson. But we had the opportunity to speak to Kelly.
Yes.
You know this young lady.
I do.
Tell us about her.
I had the pleasure of meeting her, oh gosh, quite a few months ago. She is a good friend and previous co-worker of our genetics and survivorship nurse. So she is a young lady who has come to get her care here at East Jefferson with the diagnosis that I had 4 years ago. Which is? Triple-negative breast cancer. It's a very, very aggressive form, actually the most aggressive form of breast cancer that you can have. So it's kind of takes your breath away, right? Especially being in the healthcare arena and knowing what that means and what it can mean. And so Abby had reached out to me and said, I have a friend of mine who has been diagnosed with the same thing you were several years ago. How would you like to get together? We can talk and maybe you can help her through it. So we got together, did some prayers, and she's just an amazing woman, and she's done so phenomenally well. Our nurses here have been, we have a great team, a great team, and I think we've been able to support her through her difficult time. That means so much when you're going through that. You know, when you're a healthcare provider and you get that kind of diagnosis, it becomes surreal, and you just feel like this can't really be happening, right? You've taken care of people with it, and you know what it means, and then it's just kind of like the walls come crumbling in. She has been just a wonderful person. She's just an amazing woman to care for, to be part of the team, to help the other patients through. She comes to the support groups, and I've had the pleasure of spending time with her at that as well.
Kelly mentioned how she can pick up the phone and call anybody, and she knows everyone on the floor by name, and that really touched my heart. I
think, you know, the oncology team, it takes a certain type of person that is drawn to that patient population. It can be very rewarding. It's also it can be very emotional and taxing on you. But the nurses and social workers and financial navigators, everybody on our team loves this patient population so much that she's just an example of the care that we provide across all of our patients. Everybody's special here, right? It's difficult not only for our patients but our family members. This is something nobody wants to hear, right? Nobody wants to get that diagnosis. Nobody wants to hear that's what what they're up against. And fortunately, the team we have here is so amazing. I'm extremely fortunate to be a part of it.
I think really from day one that I walked in, I kind of felt that there is more small atmosphere here. It's very family-like. They get to know me. Even when I had my PET scan, which is a very stressful experience for anybody with cancer, I got a group phone call with cheering in the background to say that it was clear, it was good, and that was an amazing feeling.
There was a concern that she could potentially have had a recurrence, that there might be some, malignancy coming back, and everybody was kind of holding their breath waiting for the results. And Abby, her friend here, called me up, and we all were just like, took a deep breath and was like, thank God that she's good, that she made it through. She's done phenomenally well. And it means a lot for all of us to be there for our patients, to be able to support them and, good news or bad, be there for them.
Everybody here has been so wonderful to me, and they just want to make sure that I'm doing okay. It's all about me, and that's just a really great feeling.
From everything I can see and from everything that I hear, this is a very special team.
I have to agree with you. I think they are. Yeah, I'm very, very, very blessed to be a part of them. very committed. We have nurses that work on the inpatient, the outpatient, radiation oncology. The whole Yenni Center is committed to cancer care. And the organization supports us as a service line, commitment to the patients we serve.
Wow, that's actually great. I mean, aren't those women an inspiration to us all? So realize if you do get that diagnosis, you're not alone. Now, if you would like more information, go to ejgh.org. There's much more come on Great Day After the Break. We thank you for being with us. Stay right there.